Good afternoon, ladies and gentlemen, and welcome to the session of A Woman in a Challenging World of a Smelter. As my basic is nursing, so I will be going to cover more issues related to occupational health. So in the coming slides, I'll be taking you through an overview of facts about Alba healthcare centers and the occupational health role played by the occupational nurse. Then I'll take you through the transformational phase that nurses went through from a bedside nurse to an occupational nurse, and how she approached the changes, heading toward the challenges that could be the gateway to the opportunities. And to start with, I'd like to highlight some facts about Alba. Alba is considered the first aluminium smelter in the Gulf and the fifth aluminium smelter in the world. Alba has the capacity of 2,650 employees, with 87% of them are nationals, and 140 are females. At the beginning, the medical center was coordinated in 1973 in cooperation with the American Mission Hospitals. Later on, in 1976, Alba established its own medical services. If you can see, this shows the number of the attendants to the Alba healthcare centers for the last 5 years. Though there is a negative correlation, but this is an indication of how changes improved the occupational health services that is reflected on the health of their employees, and that's why less attendance to get healthcare services. And to move forward, I'll just highlight some of the SWOT analysis we did for our center, just to move forward. So our strength consists of, we are one of the top occupational health service provider in the kingdom. We have a well-equipped facility with a good location and good space. Our employees are covered with health insurance apart from the occupational health services we provide for them. We have a skilled workforce and who are safety-oriented and have the sense of ownership. Our weaknesses comes through cost control, since we are a service department and we provide free of charge services to our employees. We have resistance to change, which is normal in each section, that there are people to resist any coming change. We have weaknesses in catching up with rapid changes, like in the advancement in the treatment, or to provide new and more advanced healthcare services. We have limited SAP function utilization. The SAP is currently the software that we are using to maintain the medical health records. The opportunities that we can approach is to adapt a new technology and to utilize the data that we have for further researches and improvement. And there is an opportunity to attain the accreditation that is coming on as per the NHRA, that is the National Health Regulatory Authority. And we have the opportunity to develop our medical staff to be more specialized in occupational health. Of course, we are exposed to threats, and the first threat is the unfavorable LME price, which is affecting the overall growth and revenues that the company gain, which will ultimately will affect us. We have the threat of a growing treatment cost all over the kingdom, and the threat of meeting the standard of the NHRA and the global disease breakout. Also, we have a threat of the migration of our trained, skilled people, whether inside the company or moving to other companies. So the occupational health nurse has different role, and I would like just to focus on the most important one, that is providing health surveillance, observing and assessing worker health, that will be on site and even in the center, like when they come to us. They do triaging. They play a role in the preventive medicine. They provide treatment for worker, whether it's an illness or injuries. They maintain alliance with Ministry of Health and NHRA and update with any rules and new regulations. We do surveying for areas at work, and we do provide health promotion and awarenesses for our employees, and provision of emergency medical services 24 hours. So being a nurse and transferred from a bedside nurse to an occupational nurse, there are some areas that we face difficulty to adapt with. So first, the environmental aspect side. The environment that we are in now as an occupational nurse is unusual environment. That is, majority of them are males and having different hazard, whereas for us as a nurse, when we go there, like to give emergency services or to attend any accident, we have to do a dynamic risk assessment. Usually, before you go to the site, there is a risk assessment, but in our cases, we have to have the critical thinking and do a dynamic risk assessment on site. The second thing is the people, how people are different from being a nurse in a bedside or being a nurse at an occupational field. In a hospital, you know your people, you know your patient. You give the treatment to the patient and he leaves. You know the doctor that you are dealing with. But in the occupational field, we have other people to deal with. We have the employees and sometimes contractors. We also provide services for publics, like we provide emergency services. We have to be in cooperation with the industrial hygiene section, with the safety department, along also with the employees itself department. And sometimes if we have rehab cases that he's not able to join back his normal work, we have to coordinate with the training department to prepare him to shift him to another place. Also, we have the unions, so those are other people that we are dealing with. We didn't used to deal with them when we were on the bedside. Also, we are dealing with external authorities that are Ministry of Health, NHRA, sometimes Ministry of Labor, and so on. Another transformation is the approaching patients, the way we approach patients. When patients come to us, we don't look at him that he's having a sickness. We have to have the critical thinking to link his condition with his working area and the hazards that he is exposed to. Like, for example, if an employee comes with itching in his hands due to the PPE, so we have to have that thinking because he got this condition because of the PPE he's wearing. And last is the documentations. Being in a hospital, our documentation is well known for us to maintain a nurse's note, to maintain an in and output chart, to maintain the employee codex, but being transferred to the occupational field, there are other documents that we have to follow, and we have also to participate in the documentation. Those are the OSAS, the ISO, the SOPs, Standard Operating Procedure, and the JSPs. So to approach the changes, we have to stop some practice, introduce a new practice, and review the new practices introduced. So the approaches, as I said, to stop the practices that we were doing at the bedside nurse, like, for example, the documentation. So at this time, when we are an occupational nurse, there is no more documentation like what we were doing before. To introduce new changes, there are many styles or approaches that you can reach or you can follow. And what we found is effective for us is the diming cycle, which is the PDCA. The P stands to define what you want or to define your SMART goals, and then move them to process, which comes the do stage. You have to put your process in action, implement it, and take out solution. Of course, you will need to rely on changing agents, or what we call them the champions, and then you have to measure the effectiveness of this plan. Again, you have to check your KPIs, whether you have met your objectives or not, and then by acting, like to communicate the new changes you have done with your team, and best communication is always direct communication. Of course, you have to keep documentation of all the processes. The last is the review. You have to do a review at the end, whether you succeeded or you failed. The review, it could be through internal agencies or even through external agencies. And this is where you can find gaps and you can fill. So I'll take you through some changes that have been brought into Alba. As you are aware that Alba having a harsh environment, and especially summer is coming, we used to have a high number of heat exhaustion cases. So what we have done, we thought of having champions at the site to take the lead, to aware people and to take care of any heat exhaustion case or to take measure before getting any heat exhaustion case. So we decided to train people on how to deliver those messages, and we went on site and checked how they are delivering those messages, and we awarded them as well as they are champion. And the funny thing that we introduced is distribution of watermelon. In fact, at the beginning, everybody laughed at us, but again, everybody was calling back, please come with your watermelon. If you can see, this is a chart showing the number of the heat exhaustion we had in Alba since 2012. The number was reducing, then again we had a peak in 2015. We have done a review for our plan where we found that we were not paying attention to the contractor similar to what we were doing with our employees. So there we discovered a gap, and we filled that gap by again training contractor as well, for which in 2016 the number reduced to 1. Another example of change is that as a nurse, we are there on site to give health awareness. We don't wait for the employees to come for us. We go for them on site and give them health awareness, whether related to health and even related to safety. Also, we do random screening, we do random checking for our employees. Another one, as I told you, we have 140 female employees, so we have to take care of that soft part in the industry. So again, we are conducting awarenesses for them. Another example is the on-site risk assessment and looking into the actual needs of our employee, and accordingly, we provided them with services either that is available with us or we ask for external agent for a support. Also, we shared our experience and knowledges with other students. We participated also in the community services and awarenesses. So the challenges faced by a female nurse that is related to gender, there are many. One of them is working on shift. It's difficult for a female nurse to manage between shift and family. So this is because of her gender, that was one of the challenges. Also, attending critical situation, being a female, attending ambulance call, and attending like injuries, and sometimes it could be a fatality, that was a challenge. Because of her physical power, that was a challenge for her also to be able to handle or to be able to do manual handling for injured cases. Also, it's a challenge being on site, and as my colleague mentioned regarding the PPE, though we look pretty in the PPE, but it's really uncomfortable. And even if you want to wear an earplug, especially that we wear a hijab, so it takes us time until we find our ears. So that is, again, one of the challenges. Holding a higher position in an environment full of males, so that is also a challenge. Another challenge is managing between study, work, and family. So it's difficult to have time to your study, to do your homeworks, and again, to do your actual work, and to manage to provide some time to your family. Also, there is a challenge of managing between administration and nursing. They are both different sections, but at the end, we have to manage administration as well as nursing. The last challenge is harmony over conflict. This is one of the 5 temptations of a CEO, and this is one of the best books given to us by our CEO, Mr. Tim Murray. And I would like to advise you all to read this book. You will really get benefit from it. And what's behind harmony over conflict? In fact, if you are in a position that you are in the same level with your colleagues, and then you became their superior, it's difficult to give them order or to keep them aligned with you. They will not accept it, and from your side, you will feel, leave it, let it go like it is, rather than having conflict with your employees. But it is not the way, and it's the wrong way. You have to confront them, and you have to overcome this harmony. I will not go through the quotes because time is running. So Her Highness Princess Sabika bint Ibrahim Al Khalifa, she is the empowering woman for all Bahraini women. And this quote I took it from the Supreme Council for Women: encouragement of Bahraini women to exercise their rights and take part in critical decision making. In fact, ALBA moved forward with this step, where the females in ALBA given the opportunity to develop their career and academic credits also. They are the keystone for new changes, and they are holding top management positions. And just to leave you with a real example, that is me. I joined ALBA in 2003. I got the opportunity from ALBA and sponsored to continue my associated degree in nursing. And I given a second opportunity also to be a supervisor nurse. And then they found a talent in me, so they have enrolled me in the MBA program, which I have graduated in 2016. And I'm really proud to be a member of ALBA and an owner of ALBA. Thank you, everyone.